Celiac disease, what is it? Well, it's a unique autoimmune disorder. It's unique, and this was, I believe that's out of the New England Journal. There was a recent article which got a little bit deeper into exactly what celiac is. It's unique because the environmental precipitant is known. If you look at that image, you can see there's healthy gut on the left-hand side and celiac gut on the right-hand side. Remember that as we go through some of the other images. It's precipitated in genetically predisposed people by the ingestion of gluten. So you've heard about gluten and everybody talking about how they were on a gluten-free diet. You thought that was all silliness, right? For some people it may be. That's what we're going to be talking about today. Some of the genetic and biochemical causes of what we're talking about. What is gluten? It's a lectin. The name that I didn't mention earlier was Gundry. There's a fellow named Stephen Gundry who loves to talk about lectins. I think his science gets a little bit loose in a lot of areas, but again, as you can see, there are some lectins, gluten being one of them. And most people, again, don't know that gluten is a lectin, but there are some lectins, gluten being one, that can cause very significant damage. And in fact, that damage is not just to the GI tract, that damage can go to the cardiovascular system as well. Again, that's a lot of dots to connect. We'll see how many we can do and how solid a job we can. Gluten is the major storage protein for wheat and similar grains. It can affect people at any age. It affects many organ systems. The therapy is pretty simple, gluten-free diet. However, you can still see a poor response in up to 30% of patients. One of the reasons is it is hard to completely eliminate gluten in your diet. And once you get a significant inflammatory response to this, very tiny amounts in your diet can cause big issues. Signs and symptoms: diarrhea, abdominal distension, failure to thrive, vomiting, irritability, anorexia, constipation, iron deficiency, anemia, because you're just not absorbing things well. Osteoporosis, dermatitis. One of the key points is to do a biopsy, which means, yes, you have to do endoscopy to get there. And again, clinical improvement with diet. The atrophy may persist despite an improved clinical response.